You know what? If you're taking one of those popular weight loss injections, how much weight would come back if you stopped taking it?
Previous studies have shown patients need to stay on them to keep the weight off. But it may not be the case. Let's bring in the Fox Medical team's Dr. Mike to talk more about this. So, Dr. Mike, was there a new study that showed, hey, the weight stayed off for people who, are planning or thinking about wanting to stop?
Well, Sally and Lena, look, this study was in contrast to most of the other studies that find if you stop drugs like Ozempic or Wegovy or Mounjaro or Zepbound, they're that class of drugs, you're going to end up gaining the weight back. This study found that a certain part of that population, at least with Ozempic and Wegovy, actually kept the weight off when they stopped it. Now, you might look at this like blood pressure medicine. If Sally or Lena, you come into my office, you have high blood pressure, I put you on the blood pressure medicine and it's normal now, I don't just say, look, it's now normal, stop the medicine. So for the vast majority, we need to start very low and work our way up, and that takes months. And the benefits, in my humble opinion, far exceed the risks of being on a medication long term. However, some people don't tolerate the medicines, and some people just say, look, I'm tired of this, I don't want to do it. And this gives us some ammunition that if that is the case, that in a certain percentage of people, in fact, maybe 1 in 3, may derive long-term benefits even after stopping Ozempic or Wegovy.
What about long-term harm? Has there been any studies? I mean, this has been such a big topic lately, but do we know if there could be any downsides, especially if people are using it off-brand?
Well, I have a statement that I teach the medical students all the time. In God we trust, and everyone else show me the data. We don't have long-term data, but we do have long-term data on the risks of obesity. And obesity, even if you lose a small amount of weight, you're going to prolong your life. And I'm telling you, Sally and Lena, I've been practicing 30 years. I've never seen anything like it. I have patients that have struggled with obesity. Some of them have gone for bariatric surgery. These medications have revolutionized the way that we deal with it. So, to answer your question, I don't know the answer long term, but I do know the answer that if you have obesity and you don't do something about it, your lifespan will be shortened. That's for sure. And so, in my mind, we go with it because so far, all systems are go.
Go with what you know.
Yeah, Dr. Mike, thank you so much. You're right, it has been life-changing for a lot of people. We'll talk to you soon.